The campaign was initially planned to be held from the 11th to the 25th of this month.
So when we initially announced the launching of the campaign, we realized that we needed to do more in terms of community engagement to sensitize the population about the rollout of this campaign. So having determined that we needed to do more in terms of community engagement and so forth, we then decided that the campaign must be postponed for us to be ready and to make sure that everybody is on board. Because
the ministry, Nangobe says, constantly monitors the coverage of routine immunization and surveillance data and noted with concern low immunization trends for measles and rubella. And following this, recently there was a measles outbreak in Umsati region. Nangobe therefore emphasized this calls for concrete efforts to ensure that these numbers do not increase and immunization coverage in expected districts are maintained. The ministry, he adds, has also observed with concern significant reduction in childhood immunization coverage, such as oral polio vaccine, inactivated polio vaccine, rotavirus, and pneumococcal vaccine.
Providing vaccination services for all the vaccines that we provide under our extended program on immunization, EPI. So these are vaccines for childhood illnesses, vaccines for illnesses like polio, diphtheria, and others. We are also intending to include in that campaign other services, including the provision of vitamin A to children, where we also weigh the children to determine that they are not undernourished. And we are calling on all parents and all members of the community to particularly bring their children for vaccination. As I said, it's vaccination against childhood illnesses.
During the immunization period, the ministry will immunize children against measles and rubella, screen and vaccinate children who missed other immunization doses, COVID-19 vaccination, and treatment of severe malnutrition, among others. Nangobe therefore stressed that vaccination is important for maintaining public health and therefore called for public participation. Jolana Fuka, NBC News, Windhoek.